No, it was not the case. Okay, so the floor is yours, please. You start with your opening remarks, sir, and then we'll get continued with Diana's remark.
Good morning to all of you. We warmly welcome all of you for this interesting topic and one of the most current, challenges about the sleep and neurodevelopmental delays and other aspects. I warmly welcome, Dr. Mohammad Nami, who is a neurophysician, also a cognitive neuroscientist, a great friend of mine, working for a long time, and we were only started our career, together actually, only a few months back, but it's a great achievements we could able to do. And of course, we have another good friend, Dr. Amir, who is who is a sleep medicine specialist, also pulmonologist in Baylor College of Medicine. And then we have our young, neuropsychologist, Dr. Diana Oviedo. She's from Panama, and then she's one of the most inspiring, young girl doing lot of research and building up a new career plans in neuroscience under the leadership of our chair of the Center for Neuroscience, Dr. Gabriel Britton. And then we have a team, like, we always try to work beyond borders. We don't have any limitations of, Panama, Iran, Japan, or India, or Australia, or US. We work beyond borders, making together to understand how the neuroscience need to serve the community. That's one of the big challenges we have right now. As you know that human brain is a very challenging problem. You have 1.5 kilograms of human brain. We only understood 80% or 20% of the brain. Is still 80% is unknown. We have a lot of secrets to explore about the human brain. And then still we don't know many things happening around in the biological system, in the cognitive aspects, in your emotions, in your memory, and in all these things are still a big challenge. We need to explore how to answer very complex questions. And because of this less understanding of human brain, there are many problems unanswered, both neuropsychiatry, neurodevelopmental, even normal biological activities of the human brain. So these are the major things we were looking. We have like young people like Dr. Muhammad, Dr. Amir, and Dr. Diana. All these, group, we want them to inspire to think, you know, beyond normal thinking. Because you need to explore. Everybody, if they can explore 1% or 0.1% of secret of the brain, you can keep adding up. The 20% goes up to beyond that. So that's one of the important, we always tell, explore new thinking, the human brain, so that you get new ideas, new concepts. And the brain science is the only area where everybody can work. You have a computational science, we have a biologist, we have a sociologist, we have economists, we have everybody who can work in the field. It is such a so open field in the world. So with these words, we welcome our young friend Dr. Diana to speak few words before she starts, because she's the one who is going to introduce the topic by a lead speech. Dr. Diana.
Thank you, Dr. Rao. Good morning, everybody. Welcome to our cross-border webinar on sleep and vigilance in neurodevelopmental delay. We are glad that you could join us today. First, I'm going to give you a brief introduction, and then each of our speakers are going to give a brief talk as well. Then we will have a session where we can interact some ideas, and I will also summarize the main points of each talk in Spanish for our Spanish-speaking audience. And at the end, ask questions. We'll try and do our best job answering them. And we can also interact with you. That's the most important objective of this seminar as well. So I will give this audio. Buenos días a Mario sobre sueño y vigilancia en los desórdenes del neurodesarrollo. Yo soy Diana y voy a estarles hablando, voy a darles una breve introducción sobre el tema y posteriormente el resto de los expositores van a hablar un poco sobre distintos temas asociados al sueño. Luego tendremos una sesión en la que yo voy a resumir los principales puntos que se discutieron en las diferentes charlas en español para nuestra audiencia hispanoparlante. Y finalmente vamos a tener una sesión de preguntas y respuestas. Así que por favor no se desconecten después del resumen en español para que podamos interactuar y contestar sus preguntas. Mohammad, can you, oh, thank you, perfect, thank you. So I would like to start briefly by highlighting the importance of sleep in normal situations in children. Sleep is a behavioral state of perceptual disengagement from the environment. Good sleeping habits are fundamental for optimal cognitive, mental, physical, and emotional health. And on some occasions, there are certain conditions that are associated with sleep disruptions, such as neurodevelopmental delays or disorders, which we will call NDDs for all of our talks. The next one, please. So here to the left, we can see them in blue and green, some of our disorders. The most common ones, and probably the ones you've heard of the most, are autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. But we also have specific learning disorder, motor and language disorders, and intellectual disabilities. So one of the most common complaints parents or caregivers of children with NDDS have regarding their children's health is sleep disturbances. They often go and see a physician or a therapist, and they tell them that their child is having difficulty sleeping at night, that they're having a lot of nightmares, or that they have hypersomnia and can't stay awake most of the day. So on this slide, to the right, you can see different types of disorders that exist, such as insomnia, nightmares, and night terrors, sleep apnea, which includes obstructive sleep apnea and central sleep apnea, and fragmented sleep, and others. So what's important here and what I want to highlight is that there is a bidirectional relationship between neurodevelopmental disorders and sleep dysregulations. So for example, in the case of ADHD, a sleep dysregulation may be a direct result of an underlying pathology regarding ADHD, or it can be an indirect consequence of a behavioral dysregulation that is associated with the condition. Sleep alterations are actually much more prevalent in children with ADD, with NDD than in typically developed children. Approximately 40 to 80% prevalence of sleep disturbances in these conditions. And one of the main differences with typically developed children is that sleep alterations can last into adolescence and adulthood. And as I mentioned, they are intricately related. So sleep disturbances can actually exacerbate NDD symptoms, and they are a comorbidity of NDD, or they can share comorbidities. And the causes of sleep disturbances are intricately related to different disorders associated with NDDS. The next one, please. So I want to talk a little bit about the causes, different causes that are associated with sleep disturbances in these disorders. We have sleep disturbances are actually a result of a complex interaction between biological, psychological, social, environmental, and family factors. We have certain medical disorders that can be related to sleep disturbances, For example, gastroesophageal reflux, obesity, hypotonia, hyperphagia, other neurological disorders such as seizures, motor disorders, headaches. And I want to mention behavioral problems because this is very important. Poor sleep hygiene can actually cause many behavioral problems. And parents or caregivers, when they go to a physician or a therapist and mention that their children are having difficulties sleeping, usually physicians don't take the time to explore these disturbances, but it is important to note that different environmental factors can be causing sleep alterations associated to behavioral problems. And we also have other psychiatric disorders, for example, anxiety, impulsivity, hyperactivity, and medication use that can exacerbate and contribute to sleep disturbances in neurodevelopmental disorders. So far, I've discussed how we can explain these situations and sleep disturbances, but the next step is to see what we can do, how we can address these issues. The next slide, please, Mohammed. So treatment for sleep disturbances is varied. We have pharmacological treatments, which refer to sleep aids for treating sleep problems and other symptoms that are associated to different entities. So for example, in ADHD, we would use a treatment that contributes to a lowering of symptoms regarding attention and impulsivity and hyperactivity. We also have cognitive behavioral therapy, which is one of the most common psychological therapies, specifically CBTI, which is cognitive behavioral therapy for insomnia, can help patients change their negative thoughts and their sleep-related behaviors that are affecting sleep patterns. But we also have other approaches that are actually evidence-based for reduction of stress, such as yoga, mindfulness, meditation, Tai Chi, deep breathing exercises, progressive muscle relaxation exercises. So far I've discussed sleep disturbances in NDDS, but I wanted to take a minute and mention the global health crisis we are all going through right now. The COVID-19 pandemic has had a huge impact on mental health of children and adults, actually, and on their sleeping patterns as well. So quarantines, lockdowns have disrupted routines. They have affected directly sleep hygiene and mental health. And the next one, Mohammed, please.
So are we good, or I need to flip?
And
we're good?
No, we're perfect.
Okay.
Yes. And in this case, we see that the most common sleep disturbances that have appeared due to COVID-19 pandemic are insomnia disorders, nightmares, terrors, circadian rhythm, sleep-wake disorders. And as I mentioned before, these are linked to different behavioral and psychological conditions, but they can produce directly anxiety, depression, even eating disorders, body image concerns, behavioral problems, and of course, affected cognition, especially in children. So I don't want to end this introduction with a negative note. I actually want to leave you with some positive notes. And I wanted to talk a little bit about how we can help children cope with stress during COVID-19 pandemic. The next one, Mohammed, please. Thank you. So this was actually retrieved from the World Health Organization website, but there are other reliable websites where you can find information regarding how to help not only children, but also adults cope with stress during the outbreak, the current outbreak. So one of the most important actions you can do with your children is to respond to their child, to their reactions, to their thoughts, to their feelings in a supportive way. Listen to their concerns, because this is a time where they will need extra love and attention. Most of the time, children have difficulties expressing what they're feeling, what they're thinking, and especially children with NDDs might have a very hard time to express what's going on. So it is very important for you to listen to them and actually speak kindly and reassure them. If it's possible, because I know that this pandemic is very complicated for some people, we have to juggle between work and taking care of children and housework and schoolwork. So if it is possible, especially for women, it's very complicated. If it's possible, make opportunities for the child to play and relax. So give them the opportunity to find moments of the day where they can relax and play. Also, as if it's possible, try and keep children close to their primary caregiver or to their family member. I know that this situation, it is very hard. There might be even medical conditions associated with not being able to be close. But if separation occurs, there are ways to ensure regular contact via telephone or one of these great platforms, technological platforms that we have right now. And it's also important to keep to regular routines and schedules. Structure is fundamental for children, and there is evidence that it's very important for children with NDDs to have a routine, to have a structure. And this is fundamental when you're trying to include schoolwork, but also during playtimes and also during sleep habits, because schedules for sleep and eating is fundamental. Also provide facts about what is happening and what might happen, but facts that are actually real and that we can actually verify. And try to understand, try to lower yourself to the child's level to try and help them understand what is happening, and that this can actually make them feel a little bit less anxious or a little bit less stress, and therefore contribute to improving their sleeping patterns. And as a family, you could do other activities. Mohammed, the next one, please. So it's super fundamental to have a focus on relationships. Sociability is important, group activities, games, cooking time. If the child is in a center and taken care of by caregivers, or if he or she is in their family, it's important to connect with peers, it's important to connect with teachers. Pro-social behavior is actually fundamental in dealing with the different stress that the pandemic has brought upon us.
Is Diana disconnected, Dr. Rao? Do you still have the voice of Diana, or she's not here anymore? I mean, the voice is not there, is it?
I think she should come back. 1 minute.
Okay.
Yes.
And I believe that we already have Professor Amir with us, so let me double check. That'd be great if we...
Sorry, the Zoom kicked me out of the platform. I'm sorry. And as I was mentioning, resilience, it is important for children to see an adult that is able to self-regulate, that is able to talk about their emotions, that is able to use different techniques to respond to their stress. And therefore, they will imitate these behaviors, and it can help them cope with stress associated with the pandemic. So also limit media exposure, limit technology exposure. This is fundamental for together. Creativity has a good effect on mental health, working as a team to solve problems together and to create new ideas and new projects. So I want to end the next one, Mohammed, please. I want to end this introduction by addressing some of the challenges we have in the future directions of sleep disturbances and actual mental health management in general. Access to real worthy information is fundamental. In Latin America, we're having a big problem with conspiracy theories and all of this information that isn't evidence-based, and access to real information can help reduce stress and can therefore help reduce sleep disturbances. Access to mental and sleep health services or healthcare services in general is also super important for kids to improve their sleep patterns and for adults to help them improve their sleep patterns. In Panama, we have different institutions that are providing people with different free counseling services and therapy services because this situation is difficult for everybody. So there are a little bit of health services available for mental health, and this will have a direct repercussion on sleep disturbances. Also, a very important challenge that we're facing regarding mental health and sleep disturbance is early diagnosis and appropriate screening. What we were discussing with the other speakers, the importance of physicians and therapists actually acknowledging that a sleep disturbance is a condition that is fundamentally related to different neurodevelopmental disorders and is present even in children that are typically developing. So diagnosis is fundamental. Screening correctly for these issues will help the treatment that, like you see, needs to be, like I said before, needs to be integrated. So the search for integrated treatments is fundamental. We need to look for approaches that combine pharmacological therapies as well as cognitive, behavioral, psychological therapies, and also other activities that contribute to the reduction of stress and anxiety. And finally, research. We do have a limited amount of research in low and middle income countries regarding sleep disturbances. I was actually looking for papers that published associated to the pandemic, and I found one study, but it's not published yet, in Chile that is being done right now regarding mental health and children and COVID-19. And this, of course, brings information to the table of how we can treat these conditions or how we can approach these conditions in the future. So research is fundamental and is very limited. So thank you very much. I will pass the word now to the rest of the speakers, and then we can have our interactive sessions.
I request Dr. Mohammed to briefly tell about the sleeping problems and how this pandemic is affecting all the community. You know, it's children,
Yeah, that's
women,
right.
men, all the older people, younger people, everybody.
That's right.
Please,
Yeah.
Mohammed.
Thank you so much. This has been very critical, especially more recently that we're
Little
facing
sound.
the. Can you hear me well?
Yeah,
Is it okay now? Okay. As I was
nice,
saying, it has been
fine.
recently very critical that many of the families they are having a problem of performing their family function for taking care of their children, especially when the children have some underlying neurodevelopmental problems. So uh, NDDs, as pointed out by Dr. Diana, they range from a whole different aspects of motor, sensory. Also, we have the verbal and cognitive developmental milestones. And when children are not following those specific proper milestones of neural development, one of the problems is that they either do not have the capacity of forming the good number of connections or making the neural networks in the brain, number one. And number two is that the other side of the story could be that they are having just overgrowth of this brain tree. I mean that there are so many different branches which need to be pruned, but that's not been the case because the brain, as you pointed out, it needs to get cleared up from the old waste material. It needs to, get synchronized about the brain waves, and during that synchronization and during the different stages of sleep, the brain neurochemistry will calm down into a state that the brain will clear up from all the neuroinflammatory processes. And the neuroinflammatory mediators, when they are not cleared up from the brain, then they are going to negatively impact the process of neurodevelopment and forming new synapses or neural circuits or neural networks. And based on that, the children will have the problem of either white matter hypoactivity, or deficits in the connections within the brain. And they might also have some problems with the neural plasticity. So when they're about to learn, when they're about to regulate their emotions, when they're about to harmonize the behavior that they're expected to show, they gotta have this, whole different organization of neurocognitive, behavioral, motor, verbal, and affective regulation. So when that is not actually what we are expecting, then the process will go awry, and the neurodevelopment, which is critical, especially for the three first years of life, the first 1,000 years of life. Okay, so this 1,000 golden days of the first period of infancy to toddler, developmental periods, it's critical because the brain has got a hilarious capacity, a very, very big number of stem cells coming into place, and they are going to make new connections, networks are being formed. So when this is not as optimized as expected, we got problem. So coming back to the problem sleep, when we have a very, very sophisticated machine with a super engine, but it runs and runs on, and it does not go to the garage. Not at all. So what happens? So by time, it's going to wear out, right? So this super, sophisticated machine, although that's very good, it's performing really well, by time it needs to have slowed down. So when we do not have a sufficient sleeping children, then we have problems with neurodevelopmental issues. So when parents, they are bringing their children to the clinical facilities and they're asking for neurofunctional rehabilitation. Okay, we do what? We are prescribing medications. We're doing the whole range of physical examination, history taking, and all in all. And by that, we're going to decide, we make a guess that there is something wrong, something is not right with the neurodevelopmental process. And by that, we're going to provide some modalities, either neurotechnological or behavioral, or using with some gamifications or play therapy, whatever. We prescribe medication, we do the counseling, we do the behavioral, cognitive behavioral therapies, as Diana was highlighting. Also, we are doing a whole range of neurofunctional rehabilitation. But at the end of the day, we'll see that we are very slow in improving the symptoms of that neurodevelopmental problem. Problem is that this sophisticated machine hasn't had a chance to be rested in a garage. So the sleep integrity is not there. And the structure, the macrostructure, more importantly, the microstructure of the different stages of sleep and the microanatomy of the brain waves are not like providing good support to the process of neuro development. And it is very, what I'm going to highlight here, and I'm going to pass the floor to you or Professor Amir to help us better understand about the whole thing. The key problem is that in very few instances, we as physicians or clinical scientists are asking the people who are coming to our doors with neurodevelopmental delay, we're not asking about their sleep quality and not even about the sleep quantity. Some people, some parents, they think and they assume when their child is snoring, that's pretty normal because the child is having a very good sleep, and that's why he or she is snoring. But that's not the case. Snore is a red flag, and it's like a symptom which could be signifying another underlying problem, as I'm sure that Amir will help us better understand about it. We have a range of breathing problems, sleep breathing problems, or this sleep disordered breathing in children and in adults. It might be hyperventilation, obstructive hypopnea, central apnea, central hypopnea, obstructive apnea, and so on and so forth. So they do not have the fuel to this machine. What is the fuel to this sophisticated car or machine or automobile? What is it? That's the oxygen. And when we are deprived for like 6, 7 hours over 24 hours from good breathing, good ventilation, the oxygen is not appropriately delivered to the brain, so the regional cerebral blood flow and oxygen will be negatively impacted. And the blood flow is not also there. So we have also the metabolic disorders in the brain, micro and macro, structural and ultra-structural dynamics. So by this, we face a big problem. When we start doing the tests on children with ADHD, with ODD, which is a positional defined disorder, or with NDD, neurodevelopmental disorder, as you may know, NDD is divided into two main categories of VDD, either VDD or MDD, which is verbal developmental delay or motor developmental delay. So this might be rooting from some genetic disorders, some metabolic disorders, some inborn errors, or whatsoever. But the issue is that whatever we're facing is somehow correlated with insufficiency in sleep quality. And that might be organic, non-organic. Breathing, respiratory problems, non-respiratory problems of sleep in children who are affected with neurodevelopmental delay. And what we need to do is that first we got to do the polysomnography, and I'm sure that you and Amir will help us, highlight further ideas regarding the quality of doing this very important test, which is called PSG. And for PSG, for pediatrics, we have different range of classifications and also some rules for scoring and stuff. And by that, we either go for pharmacotherapy or non-pharmacological therapies for sleep. And by this, we're going to pave the path for obtaining a better response when we're providing the kids with neurofunctional rehabilitation. They're not doing well. They seem to be overactive, hyperactive at school. They are very defiant. They are very oppositional, and they do not sit still. They are not interested. They are not obeying the parents, and so on and so forth. By this, problem is that we need to do, beside the pharmacological therapy, we need to do also some behavioral therapies. Sleep hygiene is crucial. And especially these days, parents are always talking about the negative news. They're following the COVID, highlights on TV and on papers, and they're talking, and the children are like looking at them. What is going on here? So what is supposed to happen to me? And what is the future? What is supposed to be the future of the world? I'm still a very young kid, all right? So the kid will be kind of, becoming anxious by time, and this would negatively affect the harmony of the behavioral or emotional control. We might go for, as I said before, we might go for pharmacotherapy, non-pharmacological therapy, and in some cases, when we're facing the respiratory problems that Amir will help us have a better idea about that, we might prescribe some kind of we might pursue with some kind of surgeries, because these children, they have hypertrophy of the adenoid tonsil. So we need to do some full EENT examinations and HENT examinations. We might need to have the lateral X-ray of the neck. We got to examine the back of the throat to make sure that the palatal tonsils or the adenoid tonsil is hypertrophied or not. We got to be testing for a possibility of some genetic or metabolic disorders. And by that, we're going to find the right way. It's a personalized medicine. I know, Professor Rao, that you're specializing in personalized medicine. So you and many others will understand exactly what I'm touching on. All right? So, and we might also prescribe CPAP, surgery. When it's not the case and medication do not work, there is no indication for this kind of, device-oriented therapies or surgery, then we go for behavioral therapies or neurofunctional therapies. Neurotherapies, including biofeedback or neurofeedback, audiovisual entrainment, specific kind of relaxation and mindfulness, as highlighted by Diana. It was very important, because we got to first ensure that these are all evidence-based. So as long as we're talking about the evidence-based medicine, we're fine, all right? And also CBT, CBTI, sleep hygiene training, parenting skills, are many instances it's lacking. So we got to be teaching and training parents to get a good care of the environmental, of the ambience for sleep, and all the factors that are going to negatively affect the children's sleep. And at the end, what I'm going to close with now is that it's not the diagnosis and treatment of children, specifically those children who are already affected with neurodevelopmental delay and they are having sleep issues, it's not a straightforward pathway. It's not like a one size shirt fitting all. So we got to pursue like a personalized approach. And by this, in many occasions, polysomnography is indicated. And when we identify the right corridor, then we're going to go for indicated therapies, and and that's it. So I'm sure that you have many all other different important things that you might help us better understand about the significance of this specific sleep issue concerns in children and young in children, either normal developing, typically developing children, or children with NDD. So that's my time, and I'm going to gently ask you to add on to what we already have been stating. Thank you very much.
Thank you, Dr. Mohammed. I think Dr. Amir is here.
Yes, I am.
Yeah, thank you, Dr. Amir. Warm welcome to you for this meeting. Dr. Amir, as we said,
Thank you.
he's a pulmonologist and speech specialist in Baylor College of Medicine, USA, Houston, USA. So he's going to add, new dimension in understanding the clinical, in a clinical setup, how the neurodevelopmental disorder kids, sleep things he experienced as a clinician there, we would like Dr. Amir to highlight your knowledge base on that.
Very good. Thank you. First of all, thanks for inviting me and for this opportunity to discuss the very important issue of sleep that is dear to heart of every sleep specialist. And it is still morning here, but I'm sure that it's good evening and good night for people. And that brings the issue of sleep and the time zone. I would like first to talk about the pandemic and the issue of staying at home and what effect it has on adults and pediatrics and children. So, as a sleep specialists usually emphasize, the regularity of the rise and bedtime is very important. As Dr. Nami alluded to, being physically active and having a good sleep hygiene is very important. Actually, the most important element of a sleep hygiene is the regularity. I always tell my patients that your brain is like a child, and if you have discipline, which means if your schedule is regular, that child will obey you. Unfortunately, the pandemic has resulted completely anarchy in our life. An example is my daughter that is 17. So she needed to go to bed early, to wake up early to go to school. Now she goes to bed at 12 or 1, and of course she wakes up late. And so the whole circadian rhythm in her has shifted. Same thing in adults. If they're not going out, they're sitting behind the computer and they do their work remotely, that will affect them. So, and in the